Hello, my name is Megan Filipowitz, and today I'm going to be talking about heart disease. This is from my class at Indiana State University. My instructor is Dr. Lucky. The objectives for today's PowerPoint are to determine who is at risk for heart disease, to define what heart disease is, list signs and symptoms of heart disease, discover common risk factors for heart disease, list resources for more information about heart disease, determine treatment for heart disease, and educate on ways to decrease your risk. At this time, if you would open the link in the description of this video and take the pretest now, you may then review your answers which are listed below in the pretest, and then continue on with this presentation. So what is heart disease? According to the CDC, heart disease refers to several types of conditions, the most common being coronary artery disease. Coronary artery disease decreases blood flow through the heart, which can lead to heart attacks. Heart disease can be described as the silent killer because many people don't know they have any symptoms until they have something serious like a heart attack. Unhealthy lifestyle choices is one of the leading causes of heart disease. It is important to evaluate your risk, which we will do in the next few slides. So what are some signs and symptoms of heart disease? There are two common diagnoses that fall under heart disease. The first one would be a heart attack. Signs and symptoms of this include chest pain, heartburn, nausea, neck pain, shortness of breath, and if you have any of these symptoms, it's important to be seen immediately or call 911. Next is heart failure. This one is more long-term, but you can still see the side effects somewhat early on, and those include fatigue, swelling in the arms, feet, chest, stomach, neck, and face, and shortness of breath. Again, if you experience any of these signs and symptoms, it's important to follow up with your primary care provider, or if you're feeling it is more emergent, you may call 911 or go to your nearest emergency department. So what are some risk factors for heart disease? First off, we have smoking. Smoking can cause a buildup of plaque in the arteries and breakdown of the blood vessels, decreasing the ability of your heart to pump blood through your entire body. Next, we have age. As we age, our ability to pump blood throughout our body can be decreased, and this can be because the elasticity or the stretchiness of the vessels can decrease or harden. Other serious health conditions are also risk factors. This includes diabetes and high blood pressure. Other risk factors are being overweight, excessive alcohol use, high cholesterol, and lack of physical activity. Exercise can be a key treatment of heart disease. It's important to have a healthy lifestyle as well as a healthy diet. So what are some diagnostic tests that can help determine heart disease? First off, we have CT scan, which is imaging done of the body. This can determine the size and function of your heart based on scanned images. Next, we have ECG, which is electrocardiogram. This is done where electrodes are stuck to different parts of your body, and then the machine runs a test and looks at your heart rate and rhythm to make sure you don't have an abnormal heart rate or rhythm. This can include things such as atrial fibrillation, which is where a part of the heart spasms uncontrollably and is unable to pump blood effectively. Because of this, you are at higher risk for blood clots and a heart attack. Next, we have a cardiac stress test, which uses an ECG. They hook you up to the monitors and then have you exercise, typically on a treadmill, and they monitor your heart rate and rhythm to see if exercise affects any of those things. Blood work can also be done to diagnose heart disease. Typically, what is looked for in blood work is high cholesterol and lipids, so they look at your high and low cholesterol levels, your triglycerides. If any of those are high, you may be at risk for heart disease. Next, we have the echocardiogram. This is similar to a CT scan, except it uses ultrasound and it looks directly at the heart, and it looks at the chambers of the heart to determine size and vascularity. And it can also determine how appropriately the blood is flowing through your heart. If there's a blockage or if one of the chambers of the heart seems too thick, this can lead to heart disease and heart attacks. Lastly is a coronary angiogram. This uses a special dye which is picked up by an x-ray. The dye is injected into your blood vessels, and it looks at all of the blood vessels surrounding your heart to see if there are any blockages. This is primarily used when signs and symptoms of a heart attack are to be seen, because it can determine if there are any blockages, which can be the heart attack happening. So what are my resources? For resources, we have the CDC website, which is the Center for Disease Control, and you will see in the hyperlink that it specifically leads you to heart disease. Next up, we have the American Heart Association website, www.heart.org. This is a very broad website that discusses several different diagnoses with heart disease and different conditions that have to do with the heart. Next up, we have the Heart Foundation, and this is specifically a link about heart disease, and it gives different resources for you to look through. There's resources regarding organ donation, more information about heart disease, signs and symptoms of heart disease, where to reach out to, different specialties that doctors use regarding heart disease. And it also includes a few community resources. So people who have already been diagnosed with heart disease, someone you can talk to if you are concerned about a diagnosis of heart disease or have already been diagnosed with heart disease. Lastly, we have the link for tobacco cessation, because smoking is a very high risk factor for heart disease. It is important to stop smoking if you are currently smoking and find ways for community support and different ways to stop smoking. And that is the conclusion of this presentation. Here are my listed resources used to find more information about heart disease. And if you ever have any questions or concerns about heart disease, please speak to your primary care provider or those in your community. Thank you for watching. As always, thank you for watching my presentation, and hopefully this helped give you more information about heart disease. Again, if you have any more questions, please reach out to your primary care provider. Follow the links I have listed as well, as these are great resources that can help you find more information about heart disease, ways to prevent it, and how to treat it. Thanks again. My name is Megan Filipowitz, and this was for my course at Indiana State University. Thank you.